So we need to see what we can do to make sure that that happens. With that, I yield back.
Thank you. The gentleman yields back. The chair recognizes Ms. Craig for 5 minutes for questions.
Thank you so much, Mr. Chairman, and thank you so much, Secretary Becerra, for taking the time to answer our questions about HHS's proposed budget. It's so good to see you again. I had to step out for a few minutes of our hearing, but I'm just wondering, did my colleagues on the Republican side of the aisle issue a budget while I was away?
No, Congresswoman.
Okay, good. I just want to make sure I was up to date. I want to use my time today to discuss the mental health and substance use disorder crisis currently facing our nation. I represent the 2nd Congressional District of Minnesota. Our state is home to some of the most recognizable names in healthcare, including the Mayo Clinic and a host of medical technology companies. We consistently rank in the top 10 of all states for access to and quality of care, and we've recently emerged as a beacon of reproductive and gender-affirming care in a country where states have grown increasingly hostile toward the concept of individual choice and freedom. In short, in Minnesota, we have a lot to be proud of. But even as Minnesota operates on the cutting edge of healthcare, I'm hearing from my constituents that mental health and substance use disorder-related crises are only rising. Often, our law enforcement officials, our healthcare workers, and our teachers are being forced to intercede outside of their areas of expertise to de-escalate dangerous situations. And it's causing a malicious cycle of mental stress for both them and the people in their care. According to a recent analysis published in the Minneapolis Star-Tribune, which I would like to ask to be entered into the hearing record, the number of behavioral and mental health patients transferred from hospitals in the Twin Cities area to out-of-state facilities more than doubled from 66 in 2017 to 154 in 2021. Further, hospital-based mental health care workers are in short supply, with 80% of Minnesota counties designated as areas with a mental health shortage. From 2011 to 2021, the age-adjusted death rate due to opioid overdose in Minnesota increased from 5.3 per 100,000 to 17.9 per 100,000, more than threefold. I'm proud of the bipartisan work we've done on the Energy and Commerce Committee to improve mental health across the nation. I believe we have to attack these overlapping national crises head-on through a comprehensive whole-of-government approach. So, Secretary Becerra, can you describe how the department coordinates with other agencies like the Office of National Drug Control Policy and the Drug Enforcement Administration?
Congresswoman, thank you for the question and for the work that you've done on this issue. Because drugs fall under the jurisdiction of Health and Human Services as medicines, and because they fall under the jurisdiction of the Department of Justice when it comes to enforcement of our laws, drug laws, we have a joint effort that takes place on some of these matters. Oftentimes, we find that in trying to move in a direction, for example, making medications more available that might be listed as harmful drugs or drugs that can be abused, we find that law enforcement and the health sector don't always see eye to eye. DOJ, DEA, ONDCP, Office of National Drug Control Policy, all of us working together with HHS and others, we try to make sure that we're consistent in the way the federal government handles this. For HHS, we want to make sure we're concentrating on health and making sure that whatever we do with our policy on drugs, it provides for the best outcome healthcare-wise. And so we work with our different agency partners to make sure we can move forward. That's why, for example, on the X waiver, we were able to make it possible for physicians to actually prescribe treatments that could help someone survive an addiction, at the same time wouldn't put themselves in jeopardy of being accused of actually trying to feed a drug habit.
Mr. Secretary, I just want to end with, I'm incredibly pleased to see you request $190 million in increased funding for 18,000 new behavioral health providers and expand Medicare coverage of and the payment for additional behavioral health professionals. We appreciate your continued focus on these areas that are going to help support underserved communities and in particular rural areas. So appreciate it, and thank you for coming.
Thank you.
I yield back.
Thank you. The gentlelady yields back to